The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES. With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. Hope you're all fine and had a great weekend. This is Gil Lederman, and running the show tonight are the pillars of WOR, Noah and Ed. They're manning the phones, and you're welcome to call us. We're live. You can pinch us if you don't believe it. We are at WR Studios, which is 1-800-321-0710 if you have a question. 1-800-321-0710. The show is devoted to learning about how to live better, how to live longer, how to have a better quality of life, how to avoid pitfalls when you go to the doctor, or if you want to come and see us. We're a cancer treatment specialty center, private center, which means we work for you and not the drug companies, for you and not surgeons, for you. To us, you are the president of the United States, of your body. You get to decide. We work for you, not the other way around. I know a lot of people think, the doctor's in charge and the little patient is like a mouse. No, the patient is the president of the United States, of your body. We work for you. We get your information. We give you copies of it. You can look at it. You can go home and look at it. We think you should have those copies. We think you should know your options. We think you have choices. That's why we make our phone number 212-CHOICES, because we really mean that you have the choices. We can help you provide the choices, and maybe you haven't heard of the choices before for your case, but there usually are choices. In fact, I'm just making a new publication now about the choices and how clear there are such differences in choices and how they can affect your life. You can have a tumor in your brain, and if you choose surgery, you may never hear again with that ear. If you choose us, radiosurgery, 97% you'll hear. So which would you rather have, surgery and you don't hear, or non-invasive stereotactic radiosurgery, and you hear the differences are so vast. With bladder cancer, you can choose surgery, remove the bladder, and urinate never the same again the rest of your life. Or you can be treated with us and most likely keep your bladder and your way of life. It makes such a difference. You can have breast cancer and lose the breast, or for most women, keep the breast with radiation. And there's data to show equal or better results. We're not talking about sacrificing results. We're talking about keeping your quality of life. So these are just 3 examples, but there's so many examples. Skin cancers, where we see people often getting deforming surgery, when there can be instead focused external radiation, radiosurgery, and different forms of radiation that are non-invasive, that are not deforming. And so many skin cancers affect tissues around the eyes, the nose, the mouth, the ears, the tissues that you see and that you care about, the tissues that other people see. That's where the sun hits, what's exposed. It's not something you can hide with a shirt or your pants or your socks. So there's so many choices, and you get to choose the choices, whether it's breast cancer or head and neck cancer, or whether it's removing your larynx, your voice box, versus maintaining it, keeping your hearing, losing your hearing, keeping your prostate and your sexual and urinary function, or losing it. There are such vast choices, and you get to make the choices. It's not the doctor. The doctor can offer you his or her perspective, and that's great. And we encourage people to get second opinions, because different doctors may have different opinions. Now, Rembrandt and Picasso didn't paint the same. They were both painters, but their painting is totally different. Why? Because they viewed the world in a different way. Just like you may view the world differently than your doctor, or than the second doctor or third doctor. So that's why we encourage you to sit down and learn about your choices, and we'll get you your documents. You review your documents, and then we discuss all the choices available for you. So this is Dr. Lederman, Radiosurgery New York. I think we have a caller. Is that right? Okay, who's on the line tonight? Okay, Peter, how are you tonight?
Doing well. Thank you for taking my call, sir.
Anytime. How are you tonight? What's up? What's your question?
My question is, in a stressful world such as we live, can stress in itself cause cancer?
Well, look, there has to be a randomized study to answer that, and all of us have stresses in different ways. There's different things. There's just a study that came out, which we're going to talk about tonight, that shows people that are obese. Like there's a study in England that obesity increases significantly cancer rates in certain cancers, like uterine cancers and others. We'll talk about it. Or smoking. There's a group of smokers and non-smokers. But stress by itself has not been proven, and I know many people, many patients come to me and say, I know, Doc, I got this because of stress. Well, I don't see people who come to me and say, I have stress, but I didn't get cancer. So I think that there's many reasons out there that we get cancer. A lot of them are self-induced. We just talked about skin cancer and the sun, talked about smoking, we talked about weight. There's certain family genetics that come into role, but stress is not one of the important ones, sad to say.
Okay, just curious.
Thank you very much.
Taking the call.
Hope you have a stress-free life.
I'm trying.
Okay.
Have a good one.
Work hard. Thank you, and God bless you. I want to talk tonight a little bit about a woman who came to us from Virginia. We have a lot of patients who come from far away, and they come for a variety of reasons. I'll tell you all the great reasons, but it'd be all like self-promotion, so I don't want to tell you that. I don't want to tell you that we're number one, and we return your calls, and we give you information, and we communicate with you. And with us, you don't talk to a machine, you talk to the doctor, and you don't have a student. And we're a private center, which means we work for you. We don't work for the drug companies. You can choose any of those reasons, but for whatever reason, this woman has been coming to us for many years. Her oncologist sent her to us She's from Virginia. She's had metastatic lung cancer, stage 4, and a lot of people will say, it's a death sentence. But no, there's a lot of people with stage 4 cancer that we treat that live many, many years, and she's one of them. She's a 54-year-old woman. She's a mother of twins. She has lung cancer. It's spread to the brain and the lung and the lymph nodes and the abdomen, and we've treated many sites. In fact, a year ago, we treated a brain metastasis, and we've treated a metastasis in the abdomen and in the chest, and they're all in remission. All the sites we've treated are in remission. So why am I talking about her today? Well, one is that for certain people, you don't need to have chemotherapy. You can have radiosurgery. If some site is bothersome, you can treat that, and if something is growing, you can treat that, and then you go home and we repeat the tests every 3 months or whenever you have symptoms. Now, this woman came a year ago. She had brain metastasis. Usually people say, brain metastasis, it's like a death sentence. No, but she's doing great. Doing great. Her boys graduated from college. She was treated with radiosurgery with us. Unfortunately, she saw another doctor back elsewhere, out of state, a neurosurgeon, who said, I have to take out that tumor in your head. So she let him. No one called me. He didn't call me. The patient didn't call me, unfortunately. And he took out the tumor. He opened up her head and took out the tumor, except there was no tumor. It was just dead tissue. I'd given her radiosurgery. The tissue was dead. So she really had surgery for not much of a reason. And that's why it's important really to communicate. We think it's really important to communicate. My patients have my cell phone. They call me day or night. They can talk about what they want to talk about. I wish she had called me. She's doing great. I saw her this week. She's back up from Virginia for a checkup. She's doing fantastically even. And she's continuing on, hoping to see her sons get married and have some babies. So she's doing fantastically, years out from stage 4 cancer. And another man who flew in from Spain this week with a cancer of the ampulla of Vater. The ampulla of Vater is the site where the biliary juices and the pancreatic juices flow into the intestine. So it's like a little valve. If you think of it like a plumber, it's a little valve. Well, this little valve got a little cancer, and because that site is so critical, he became jaundiced or yellow because the fluids backed up in his body as soon as he had the cancer. So he was diagnosed early and came to us early for fractionated stereotactic radiosurgery. Now, a lot of people call for the booklet, and we have a booklet and DVD which we send out, and they say, but you didn't talk about my cancer. Well, the problem is there are thousands of different cancers. Ampulla of Vater, for example, I've spoken tonight, or lung cancer, or fallopian tube cancer. So we can't, in the booklet, talk about each particular situation. That's why we meet. And often patients, unfortunately, don't even know their situation. They haven't been told their situation accurately, and they haven't been given the documents. So we like to tell you exactly what you have, give you your documents so you and your family can review them and better understand them and ask questions about what's going on, why do I have this, what are my options, and what should I do. So this man with ampulla of Vater carcinoma came from Spain because he's seen our patients, and seen our patients in Spain who told him about great results from radiosurgery treated in New York at Radiosurgery New York. So word of mouth is a very powerful tool, and for this man, it led him to cross the ocean, to come to New York, to be in our facility where he's undergoing treatments, focused, non-invasive treatments called radiosurgery. And I want to talk about a woman who called me this week from Long Island. She was treated in 2000, 14 years ago, with a cancer of the jaw. She called me up just to say, and I have the note in front of me, it says a message for Dr. Lederman from the patient's name. Patient treated you in 2000. She called to say she's very thankful for what you've done for her. Thank you. And then I called her up just to say hello. I haven't seen her in many years. And she said, by the way, I have a lump in my breast. I want you to take care of a lump in my breast. Well, that's certainly also the work that we do. Many women come to us, and not only women, but many people come with lumps, and they want to know what exactly it is. Is it cancer? And we've seen several big lumps in the breast. And we can just put a needle in the breast. We can biopsy it, but painlessly, without cutting, without incisions, without the operating room. Just numb up the skin, put a needle in, suck out some cells,